Hi, I'm Nurse Bob. Today my topic is heart attacks, which I've been talking about on my other blog, Nurse Bob's other blog. I'm going to cover the symptoms. I'm going to talk about exactly what a heart attack is. And I'm going to talk about what the risk factors are, what we can change and what we can't. All right, let's talk about risk factors. So, what are the risk factors? So, there's two kinds of risk factors. There are non-modifiable risk factors and there are modifiable. What does that all mean? Well, the non-modifiable things are things you can't change. You can't change your age, except, by getting older, which is probably a good thing. At least, from the cellular level, you can't change your gender. You may have other options in terms of, social aspects. But your body still knows, whether you were born with X and Y chromosomes or not. Your race can have a real impact, and that's not something you're going to change. And, of course, your family history. If your grandparents on one side, your grandfather or your grandmother had heart history, and your father did or your mother did, again, these will play a role. And, of course, if there's heart issues on both sides of the family, all the more. It's more of an issue. So what about the modifiable risk factors? Well, modifiable things that, those are things that you have a choice about. You can choose to smoke or not smoke. Physical activity, are you active or are you, the classic couch potato? Are you in between? These things play a role. I mean, they do affect how your heart works and how well it works. Certainly obesity plays a role. Fat tissue not only requires its own oxygen and nutrient supplies, but it also makes the heart work harder just to both push the blood through the fat tissue as well as carry it around. High blood cholesterol is certainly can play a role. And I'm speaking here of blood cholesterol, not dietary cholesterol. In essence, the cholesterol that's in the blood plays a role in, laying down deposits in the arteries in particular, which can narrow the blood vessels. Dietary cholesterol, what you eat, apparently has, less of a direct impact on the health of your blood vessels, but it can certainly have an impact on how much cholesterol your body has to deal with. Stress and behavior. I'll talk about stress in a later episode, but if you're driving to work every day and you're sitting in traffic for hours and it's making you insane, your body responds to that as if you're in a fight. So, it kind of raises the adrenaline levels, it increases the sugar in your blood, and if you keep doing this day after day, day in and day out, it causes changes to your kidneys, to your circulatory system, and those changes, unfortunately, are not good changes. Finally, blood pressure. Just think about it in the terms of the plumbing in your house. If you have a high-pressure system, over time, it's going to, weaken the connections and weaken the pipes, and the same thing in the body. If you are always running with, the heart pushing hard to get the blood around the body, both the heart has to work harder. It's going to increase in size, which actually is not good for the heart. And, of course, you always run the risk of a blowout. I mean, you may start bleeding into your brain, or, if you remember about John Ritter, the actor, he had, an aneurysm, which is sort of like, a balloon in the blood vessel. He had that happen in the main artery coming out of the heart in his, down in his, I think it was an abdominal aortic aneurysm. So when that ruptured, he basically bled out very quickly. These are events that are very difficult to survive. So, you have choices about what you do. Do you smoke? Do you exercise? Do you gain weight, lose weight? Do you address the cholesterol in your blood, which you're going to have have blood tests to check that out? Do you try to manage the stress in your life? And do you take care of your blood pressure? Well, at this point, I've pretty much rapidly covered all the topics I wanted to get into with heart attacks, and it's a real quick overview of the symptoms, the causes, outcomes, and risk behaviors, risks that you can change or can't change. And in the future, I'll be talking about things like smoking, physical activity, your weight management, cholesterol, stress, and blood pressure as separate items. But for now, at least you have a little more to work with. And of course, on my other blog, the text blog, you can actually go read some more about this. I covered it in somewhat greater detail in that area. So either keep an eye out for what's coming here, or go over to Nurse Bob's other blog, Nurse Bob's blog. Both all my blogs are .org. And, you can read about it, and there's references both here on this site and the other site. So again, till next time, look forward to talking to you all, and stay well.